Hello students, welcome to this session. Let's study other body fluids. So other than CSF, pleural fluid, pericardial fluid, peritoneal fluid, synovial fluid, gastric fluid and sputum.
Hello students, today we will talk about pleural fluids. What is pleural fluid? It is a fluid present in pleural space. So what is pleura? Pleura is a covering of the lungs. They have two layers, that is inner visceral layer and outer parietal layer, and the space in between these two layers is called as pleural space, and the fluid in between this pleural space is called as pleural fluid. Normally it is present, which absorbs the shock in injury, and then it gives nutrition, and it is protective in nature for the lungs. So when fluid the amount is increasing pleural space, it is called as pleural effusion. Collection. So according to the x-ray findings, you can find out whether which side this pleural effusion is there, and then you can clean that area with spirit and povidone iodine, give local anesthesia, and then prick the area with needle, and then with catheter, and then aspirate the pleural fluid.
Pleural fluid routine examination, physical examination quantity, odor, clot, then specific gravity, chemical examination glucose protein, microscopic examination, total count and differential count.
Hello students, today we will see peritoneal fluid examination or ascitic fluid examination. So what is ascites? It is a increase of fluid in the abdominal cavity more than 25 ml or up to 1 liter. So the examination of that fluid is peritoneal or ascitic fluid. So clinical significance, so normally no, less than 100 ml of fluid is present, but when the fluid is increased, then it is called as ascites. And in here in this picture you can see this abdomen is become so big because of the collection of the fluid in the abdominal cavity, that is it is called as ascites. So that the removal of this peritoneal fluid, that is abdominal paracentesis, is you have to do because of the intra-abdominal hemorrhage, and the reasons for that is trauma or intra-abdominal pain or post-operative condition or ascites of unknown etiology, or the instillation of cytotoxic drugs in the ascites due to malignancy. So this ascites may be because of the malignancy or low proteins, so that we have to find out. Malignancy can be ovarian tumor.
Peritoneal fluid routine examination. So physical examination, color, then chemical examination, glucose, protein, amylase, alkaline phosphatase, microscopic examination, WBC count. Pericardial fluid present in between two layers of pericardium. Outermost layer of the pericardium is the pericardium, and then it is of two layers, visceral and parietal pericardium. So the space between visceral and parietal pericardium is the pericardial fluid. So it functions as protection, shock absorption, nutrition to the heart. Indications of pericardial effusion may be because of tuberculosis or rheumatoid disease. Collection procedure, it is mostly collected under sonography. Clinical civic significance, increased amount is seen in the heart congestive heart failure, cloudy appearance seen with the bacterial inflammation, rheumatic or rheumatoid inflammation, blood seen because of the traumatic tap, and grossly bloody fluid may be because of the bacterial pericarditis, post-myocardial infarction syndrome, tuberculosis, SLE, leaking aortic syndrome. Pericardial fluid routine examination. So physical examination, color, chemical examination, glucose protein, microscopic examination, differential leukocyte count. Synovial fluid is found around the joints such as knee, ankle, hip, elbow, wrist, and shoulder. The chemical composition resembles that of other body fluids such as serous fluid and spinal fluid. In addition, it contains mucopolysaccharide, then hyaluronic acid, which acts as a binding and protective agent for the connective tissue. So function is protection, absorption, and nutrition. Collection is collected with help of syringe and needle from swollen joint under sonography. So synovial fluid routine examination, physical, color, viscosity test, mucin clot test. It is increased in the inflammatory disorder. Chemical examination, glucose protein, different microscopic examination, differential count, and the crystals like now urate crystal, rhomboid, calcium, pyrophosphate crystals. Gastric fluid is juice collected from the stomach, consists of 90% water and then hydrochloric acid, pepsinogen, and intrinsic factor. The indications of gastric fluid examination: diagnosis of disease of stomach duodenum, pernicious anemia, tuberculosis in children because children may swallow sputum, and diagnosis of CS stomach. Collection of gastric juice. So first preparation of patient. So patient is asked to take light early dinner. Then intubation. So rice to be passed into stomach early morning. Tube must be clean, boiled in water and lubricated with glycerin. And then patient is asked to take deep breath, and then it is either inserted through nose or the mouth, and then it will go up to the stomach level, and then with help of syringe, the material is aspirated. The contraindications of the hematemesis, hypertension, heart disease. Gastric fluid routine examination, physical examination, volume, color, mucus, chemical examination, free and total acidity, occult blood, starch and bile, microscopic examination, pus cells, RBCs, malignant cells, and then Z instant can be done for the AFB, acid fast bacteria in tuberculosis. Sputum is the saliva plus material from the lower respiratory tract, that is lungs and bronchi. So collection, the patient is instructed to rinse the mouth, so to avoid the contamination of food. Then ask the patient to take deep breath and cough, and then material is expectorated, that is collected into the sterile container. If routinely the acid-fast bacteria not seen in sputum by ZN method, then concentration method, that is Petrov's method, is used. So in that, extra material like mucus, pus cells, and epithelial cells are digested, and then you can see tubercle bacilli. So in collection of the sputum is mixed with 4% NaOH and then placed in incubator for 30 minutes. Then it is mixed for few minutes so that the digestion of mucus and epithelial cells takes place, and then centrifuge at 3000 rpm for 30 minutes, and then deposit is neutralized with 8% hydrochloric acid, and then yeah, that material is concentrated and you can use for the examination. So routine sputum examination. So physical examination, quantity, color, consistency and appearance. Chemical examination, pH and occult blood. Microscopic examination. So in wet mount you can see pus cells, RBCs and some Kirschmann spiral which seen in bronchial asthma. Then some crystals, charcoal-laden crystals, hematoid crystals. Some parasites like Entaminma histolytica, larva of strongyloids, and then other differential count like neutrophil, lymphocyte, eosinophil and erythrocytes.
Hope you find this session useful for your understanding and for your exams. Thank you.